India is right now devastating with surge in cases and deaths. I'd like to know how you're observing it, and how does all of that impact the global communities?
Well, as you mentioned, we've been seeing tremendous numbers of COVID infections in India, the highest that we've seen worldwide. And it's scary. And I think a lot of it is that people are not taking it as seriously as they need to with masking and keeping their distance from others. And we're seeing the result of that. The hospitals in India are completely full. ICUs are completely full, and people do not have proper access to healthcare because of the extreme volumes that we're seeing of patients affected by COVID. I think it's a very strong reminder to all of those worldwide to ensure that they maintain their vigilance of frequent hand washing, maintaining their social distancing, wearing face masks, even as people are getting vaccinated, and just avoiding large group encounters.
Right. You know, in India, we saw a huge Hindu festival that happened, which had millions of people who attended in maskless. There were also election rallies being held in the last couple of months with, again, people who were maskless. How much of that do you believe, affected the surge of cases? Because it just came, and now it's, all over the country.
Yeah, no, I think it definitely had a huge influence on the numbers that we're seeing right now. And just as we saw in the United States, huge spikes during the holidays because people were still getting together. When you see large congregations of people getting together in India over those special events, now we see the impact of that. And I think it's an important reminder to those in India to avoid huge public gatherings until we've gotten everything under control.
Right. Dr. Vohra, is this similar to the surge we saw here last March, April? Where we lost a lot of people.
It's a combination of the two surges that we saw here. Surge 1 that we saw in the United States had a very high mortality rate. Surge 2 had a very high volume, but a low mortality rate, meaning lower death rate in comparison to the first round. In India now, we're seeing a combination of both, very high numbers and a pretty high mortality rate. So we need to ensure that people are taking every precaution necessary. Even family members of mine have been affected this time around. Numerous family members, which really hits home because you recognize that this is a really big deal. And being that people were able to see what happened in other areas of the world, and yet this is affecting them now, is disappointing because, it's just something that needs to be taken seriously. And I think India needs to take a step back and look at ensuring they protect their population by avoiding any large gatherings going forward and really getting to strict criteria of mask wearing and separation.
Can vaccines help this surge, doctor? I know the U.S. is trying to send some AstraZeneca shots there to India. I know other countries are also trying to ramp up and help them. Is this going to be solved by vaccinations?
In time. Is it going to fix this surge? No. It's going to help prevent another surge from occurring. I'm hoping that the peak will end very soon. Because I think now this huge volume of people that have been affected and infected by COVID will change the mindset of those throughout the country to be more careful and to maintain their safety barriers, and getting more vaccine to them will prevent another surge from occurring in the future. So it can only help, but I don't think it's going to solve this issue that we're currently in, because even with the vaccination, if you're taking the 2-dose regimen, it's typically taken a month apart and then another 2 weeks to really reach full immunity, so to speak. So you're talking about a 6-week time period till effectiveness. Now, if you're taking the single-dose vaccine, it's a little different, but again, it takes weeks to make an impact in terms of having some type of immunity against the COVID virus. But again, it's going to take us time to get it distributed throughout India.
Right. What are your predictions for the next 2 months for India? Do you think they can control it in that much time?
Well, as we saw in the United States, once the public gatherings and holidays passed, the numbers dropped. So I would expect that in India, over the next few weeks, we'll see a drop in numbers. It's just so unfortunate that the numbers were so astronomically high during this current outbreak.
Right. What's the worst case scenario here, doctor, if it doesn't get controlled?
Death. It's a high mortality rate. I mean, this has killed, thousands, millions of people have been affected by COVID. This is something that can wipe out a significant amount of the Indian population if it's not taken seriously. So drastic measures need to be taken now.
Right, and it is the world's second most populous nation. It affects all of us. Do you think travel should be banned right now between India and other countries?
I do, yes. I think we're at a point where it's out of control and extremely dangerous, and I believe that travel should be banned right now.
Right. Let's now talk about the United States, doctor. I have lots of questions on it. My first question to you is, experts are saying that case numbers are decreasing right now across the nation. How are you observing that? Is that actually happening? Are you feeling a little bit better about these case numbers?
I am. I'm feeling really good about our case numbers. A few weeks ago, we did have a small surge, and I say a small surge of cases of COVID, but that calmed down, and our numbers are continuously reducing day by day, week by week, and we're continuously seeing an increase in the amount of COVID vaccinations being given. Now throughout the country, we're giving more vaccines than have ever been given before, with a goal of summer being kind of full-blown, a large amount or a majority of our population being vaccinated, those being adults, of course.
Right. How are the hospitals looking right now? You do work in the area, you're the head of the department. How are the ICUs looking? Is there more space now?
There is. There are times, of course, that the ICUs are full and the hospitals are full, but it is not because of strictly COVID infections as it was in the past. This is just due to other illness in addition to some COVID cases, but our ICUs and hospitals are not just full of COVID patients anymore.
All right, let's now talk about one of the biggest news that we saw yesterday, doctor, this new guideline that came out from the CDC about people who are vaccinated and how they can go without a mask outdoors in certain settings. Now, many people are concerned about the fact that many unvaccinated people could also start doing that if there are no mask mandates there. But how are you looking at it, and what do you think we can do as vaccinated people outside?
The specifics of not wearing a mask outside are limited to small group gatherings where all of those around you are vaccinated. And remember, just because you're vaccinated, you can still get COVID. So it doesn't give you 100% immunity. So it's important to still remember that you need to be careful. I think it's also important to have that nice benefit of knowing, okay, I've gotten vaccinated, I'm at my immune window now, and it's okay for me to take my mask off with small get-togethers of those that I trust to be vaccinated. But people have to be trustworthy. They need to be honest, and they have to remember, if they're not vaccinated, not only they're hurting themselves, they can hurt other people around them. And we hope that people are honest and don't abuse this release of limited mask wearing for those that are vaccinated. So we only hope that people do the right thing. That's all we can do right now.
Do you think this guideline has come too early, Dr. Vohra? Do you think we're ready as a nation to adhere to it?
I think we are ready because we have a significant amount of the population already vaccinated. So I'm really excited that the numbers look very promising for this summer. And I think people, of course, are tired of wearing face masks and isolating. So at some point you do tend to see a break in adherence to the guidelines and rules. So I think it's good to really push people to get vaccinated so that they can be part of the population that can meet in gatherings and not wear face masks. I don't think it's necessarily rushed. I think it's important to start to separate now those that are vaccinated versus those that are not, and hope that those that are not yet vaccinated get vaccinated. And this is one benefit of doing so.
Dr. Vohra, many are talking about the fact that we have to get now used to this new normal. Many doctors are saying that. What is this new normal? What would it look like?
Well, gatherings are going to increase in the volume of people that are allowed to get together over time. Concerts and time will reopen. Public gatherings are going to reopen. Slowly things will return to normal. However, there will be a continued observation of those that are vaccinated versus those that are not. For example, what we'll see in the future is when you want to attend a concert, you'll only be able to attend after you have a negative COVID test and and after you've been vaccinated. So you are going to see a new norm of vaccinated people getting into certain events versus non-vaccinated people.
Right. Let's now talk about vaccines a little bit, Doctor. I have a question for you on that. The Johnson & Johnson vaccine was paused and now it's been reinstated and is being used across the nation. What do you have to say? Do the benefits really outweigh the risk? And following that, I'd like to know if you recommend women from the ages of 18 to 48, where we saw those blood clots happen in the country, do you recommend them not to take the vaccine of Johnson & Johnson?
So keep in mind that millions of people have been vaccinated. So in any medication that you're given, there's always a risk of a side effect. With that said, given that there were a little over a dozen cases of thrombocytopenia, which meaning low platelets, or a dozen plus of cases with blood clots that were introduced. When you think about the millions of people that received the vaccine, that's a really, really small number. You see higher side effects in everyday medicines that are given in and outside the emergency department, like Dilaudid, morphine, and antibiotics. I think it was great that they paused the vaccine rollout to take a closer look at this issue to ensure that it was safe. And now that they've deemed that it is safe, we, in fact, in our emergency departments throughout Hartford Healthcare, will be rolling out the Johnson & Johnson COVID vaccine to be offered to all patients that are above the age of 18 in our emergency departments. So that's how much we support and believe in the vaccine. And in terms of middle-aged and young women, it's still recommended, yes.
And when you're looking at this rollout of the vaccine, what do you say to people that may be a little hesitant to get the vaccine? What should they look out for with the J&J vaccine particularly?
I recommend that everyone, no matter what kind of vaccine you get, should be watching out for typical symptoms. Typical symptoms are flu-like symptoms. What does that mean? It means a fever, congestion, body aches, myalgias, muscle aches, joint aches. Those are expected side effects, and they're minor side effects. That's to be expected and nothing to worry about. Major side effects would include shortness of breath, nausea, vomiting, severe abdominal pain, severe chest pain. Those are not common side effects, but if they occur, patients should go and be evaluated by the emergency department for further evaluation. Of course, we're going to see side effects of the vaccine because it's something that's being given to millions of people. And any medication that's given, whether it's as simple as ibuprofen or Tylenol to an opiate medication, is going to have side effects when given to millions of people. So it's important to recognize that side effects are expected. However, the benefits are far outweigh the risks and side effects that we've heard about, and it's still strongly recommended that all people that are eligible for the vaccine get vaccinated.
Yeah, so true. We really need a lot of this nation to be vaccinated. Just talking on those vaccinated people, let's talk about the unvaccinated people real quick, Dr. Vohra. What do you have to say to anti-vaxxers? Unfortunately, there's a huge number of them in the country. I'd like to know how dangerous it could get for us if those people are not vaccinated.
Well, if you're unvaccinated, you're continuing to be at risk for a COVID infection and all the risks and side effects that come with those infections, because we've seen people with COVID infections get blood clots because the illness is associated with blood clots. We've seen people have heart attacks, strokes, significant pneumonias, hypoxia, which is low oxygen saturation. It just opens up the door to so many other illnesses that it really doesn't make sense not to get the vaccine. It's so important to get that to reduce your exposure and risk to these life-threatening illnesses because they can be avoided with this medication.
Right. Two more questions left for you here, Dr. Vohra. What are you the most worried about right now?
I'm worried about the children because we have not found a vaccine that's approved for children yet, although they are working on it. So that is one thing that keeps me up because I have 4 small children myself. They're 6, 4, 4, and 2. So that's one. And the other is people not taking it seriously, especially in India and areas of high congregation and population. This has been proven to be a world changer, a world killer in a sense, and it's changed every single person on this earth's face of reality. So we need to just make sure that we take it seriously. We continue to be vigilant about our safety for ourselves and those around us, for those of our loved ones as well. We continue to hand wash, wear those face masks, keep our distance as much as possible, and get vaccinated as soon as you can. I think that's going to lead to a better future for all of us.
And finally, my last question to you, Dr. Vohra. What are you predicting for the next month with COVID-19 cases and deaths here?
In the United States, I expect that the COVID-19 cases and deaths will continue to decline.